Hello everyone, welcome to Rainbow TV. This is Renu. We have a vascular specialist, Dr. Sailesh Kumar with us. So let us talk to him. Hello sir.
Hello.
How are you?
Fine.
So piles is a major problem in many of the people. How can we diagnose that?
So piles, before understanding piles, we need to understand the anal cushion, that is the area in the anus. Anal cushion is a structure in the motion tract towards the end.
Yeah.
It is nothing but a bunch of blood vessels around the anus area. So whenever we go for motion or we try to put the pressure, this anal cushion, with that pressure, it come out, and depending upon the grade, it slowly comes out and it start forming the piles, that is bunch of blood vessels around the area, and a patient can experience different symptoms depending upon the grade, because it has 4 grade. Grade 1 is a mild grade and grade 4 is a severe. Mild grade, sometimes they may not be experience severe symptoms, but incomplete passing of motion, sometimes irritation in that area, and when they go for examination, doctor sees that some bulge is there on the examination on the proctoscope. Grade 2 is something is coming out, that anal cushion will come out, and it once after passing motion it goes back inside. 3 is the one, the anal cushion comes out, but patient, it doesn't goes on its own, patient has to push it inside. And 4 is that even after pushing it doesn't go, it gets stuck there only. So patient can experience pain, bleeding, and sometimes irritation in that area, painful area, and if it's complicated, it can get infected and pus formation will be there. So it's a very miserable situation for patients, especially they experience all these symptoms when they eat heavy food like non-veg, spicy. If they're having constipation, their motion is hard every time, they have to push it hard while passing motion, so they experience all these symptoms. So diet plays a major role in this, especially if you are not having a lot of water, if your food is not, your diet is not with adequate fibers like beetroot, carrot and salads and all, and if you are eating only non-veg, non-digestible food, and then you can bound to get these piles, especially a lot of people, those who eat non-veg, spicy, and a lot of drink less water and not having proper fiber in that, they definitely have piles at some point in their life. If not now, at least in the future, they are high risk patients to develop the piles.
Like, what are the major causes, sir? And did you observe people neglecting it?
Definitely. See, because it is related to the motion area, sometimes even they experience these symptoms, they feel shy and they feel neglected. So they don't go to the doctor, seek a proper advice and treatment, change in the diet or lifestyle, and they continue to suffer because they don't know the proper reason for it. So main is the constipation, bearing down or pushing hard while going to the motion, because they're not, their stools are hard and they find it difficult, and that is the one which keeps on accumulating, and every time they go to motion, it's a nightmare for them, and that is the main reason. And the diet is another factor which plays a major role.
So are there any simple methods in diagnosing it, like the stage and all?
See, if you have symptoms, the patient definitely, they can't diagnose on their own, but the symptoms, or if they are in the, depending upon the grade 2 and grade 3, they feel that something is coming out and going in, or they have to push it hard inside, and this bleeding is there. So definitely they should not neglect it. They go to the nearby doctor at least to get it checked and find out which piles, what grade of piles it is, in which stage it is, so that the proper treatment can be given. Because sometimes treatment is depending upon the grades, because in the grade 1 and grade 2, early grades, it can be managed conservatively. You don't require any surgery or all those. But
like for diagnosing, any tests required?
no, it's just a simple test. Go to doctor, they'll examine that
Yeah,
local
sure.
area.
Okay.
If required, they put the proctoscope to see the early stage of piles, like stage 1. But stage 2, stage 3, definitely they are more obvious. You need not to put proctoscope as well. With the just finger test examination, you will find.
Okay,
So stage 1 and stage 2, definitely we can manage them with conservatively change in lifestyle, change in diet, more of water, fibers, and trying to avoid all those non-veg masalas, hot spicy food, so which will aggravate the constipation. And if you have constipation, need to control that constipation first thing, because constipation is the main reason for this to develop. So 1 and 2 can be managed conservatively, but remember, once piles is formed, it is going to bond, because there is an underlying reason like constipation or hot stools. And if you are in grade 1 and grade 2, with this conservative management, change in lifestyle, you can reduce or restrict them from going into the advanced stage. But once you have, then definitely it will not disappear on their own.
Okay.
But stage 3 and stage 4, if you are having, definitely you require a definitive treatment like surgery. Surgery where we cut those piles mass and then put the stitches. But because it's a motion area, every time you go to motion, till the stitches heal, you will be feeling the unbearable pain will be there.
Right.
But you need not to worry.
So are there any easy methods? For
Definitely. See, surgery still we are doing it, but now in the grade 1, grade 2, grade 3, there is a non-surgical treatment option available, like laser treatment, where without any cuts, without any sutures, without any blood loss, we can treat these piles and shrink them completely, and the patient will be relieved, because there are no cuts, no sutures in that motion area in the anal region. So patient will be having very free post-operative period. In the surgery, because of the stitches and they are not able to sit, there will be a lot of pain every time they go motion, which is not there in the surgery. It's a 30-minute procedure. Same day they can be discharged, same day by evening. There are not a lot of medication because there is no pain or not much of the pain, so medications are also not much required, and no blood loss, no cuts. So it's very safe and effective for the grade 1, grade 2, grade 3 piles. If you are grade 4, laser sometimes is not the only treatment where you can require, because grade 4 is the stuck piles. So we have to treat with laser as well as with the surgery, or with the surgery only.
Okay, like in how many days they can go with their previous lifestyle, like works and all?
It's a 1-day treatment, 2 or 3 days of rest, and from 4th day they can go back to their work as well.
So are there any chances to reoccur?
See, definitely, because we are treating whatever the piles has come out. So in future, if your constipation is there, if you are still suffering with the hard stools, and every time you are bearing or putting pressure, lot of pressure while going motion or passing stool, and your diet, you are not controlling on your diet, like a lot of non-veg, heavy food without any fibers, and not drinking proper water, then definitely future recurrence will be there. It is not about the treatment recurrence, it's about the habit which has causing the recurrence. So you need to have that again change in the lifestyle and all to prevent again recurrence. So
they should be careful about food habits and exercise also.
Exercise also, adequate hydration. And I very commonly see these piles developing in the summer because of the hot weather. These veins swell up, bulges, and a lot of patients experience pain and discomfort of piles more during summer than in the winter.
Okay, sir. Thank you for giving your time.
Thank you.